drug info questions from doctors and stuff too, we
Okay.
help with. So, and I get to work from home, so I can't complain.
Oh, yes. And I know the doctor really relies on the pharmacist to know.
Yes, our team that I work with just keeps expanding because the doctors that are in offices want more and more pharmacist help.
Mhm.
So definitely a growing area.
All right, good afternoon, everyone.
Good afternoon.
We'll call our Wednesday, the 19th of March Board of Health meeting to order. We'll move on to the approval of the agenda.
I move we approve the agenda for March 19th, 2025.
Any changes?
Nope.
All right, all those in favor?
Aye.
Those opposed? All right, we'll move on to the approval of the minutes from our February 19th, 2025 meeting. Any corrections or additions?
If there are no additions or corrections, I move they be accepted as submitted.
All right,
I'll second.
all those in favor?
Aye.
Opposed? Okay, the minutes stand approved. Let's go over the review of the accounts payable report next. Are you ready?
I am ready.
All right. So on the first page of your report, actually, maybe not. I believe it's page 104, yep. Third one down, SDOH assessment needs.
Yep, that is, those are gift certificates for the Adrian Medical Pharmacy. They're in increments of $10. The clients, when they come into our clinic, they fill out an SDOH form. And if we find that they need medical assistance in some way, they are given these to be able to provide any access to whatever it is, whether medication or what have you, from the Adrian Medical Pharmacy.
Okay. Down lower on that page under first bank card, the Game Crafter EP training.
Yeah, a couple years back, when Susie was here, she had purchased a game called a pod training game. And it is only for 2 to 4 players. So, we received additional funding to be able to purchase it for the group.
Okay. All right, then on the final page, second one down, ProMedica Foundation, again, SDOH assessment needs.
Okay, so that is for the same program, but this is for certificates for the Veggie Mobile.
Okay.
And these are in increments of $5. So if someone on those same forms express a uncertainty with food, we provide that to be able to, for them to be able to get vegetables
All right,
and fruits. I'm
all
sorry.
right. And then lower on the page, Sword Solutions for 1,000.
That we have been in the process of migrating to health space, but we still have the sort program, and so that software is fully built for us.
Okay.
So that is just her annual fee.
Okay. All right, any other questions about the accounts payable report? All right, I'll look to a motion to approve our accounts payable report then.
I move we approve the accounts payable report.
I'll second.
All those in favor, say aye.
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 Opposed? All right, stands approved. We'll move on to our health officers report.
Good afternoon. I have some information from our materials management division. We were able to get $14,000 worth of free educational materials, and Julie wanted me to share some information with you. She was able to get 23,000 households in the shipping covered for its free educational materials. And she worked with designers and was able to customize materials and its recycling education information. She also was able to get 20 dumpster posters, some for the current drop-off center and then some for our pilot program. And then additional 500 additional mailers that for distribution that will be going out soon. It's both in English and Spanish, and it does have our logo and drop-off center locations. Currently, Raisin Township was the first ones to receive it, but Madison, Cambridge, Village of Addison, City of Tecumseh, Tecumseh Township, City of Adrian, and Adrian Township will be receiving the mailers as well. So, and it was $14,000 worth of free educational items, so it's really, really exciting. Moving on to a monthly report for myself, respiratory illness is still there, but it is decreasing. Gastrointestinal trends are decreasing as well. Avian influenza, there has been no detections in commercial flocks in the last 30 days. There has been 2 in backyard flocks in Monroe the last 30 days, and that was impacting about 50 birds. The threat to the public remains low. There is no known person-to-person spread. As of today, there is 70 human cases in the US and 1 death. We had a march yesterday. We had a tabletop for train derailment. A lot of community partners came together and discussed immediate roles during the emergency and the following the incident. And it was a great discussion and identified some gaps and made good progress. We have ordered over 200 COVID and influenza tests. They are a combination test that will be given out to the public for free. They will also be at any of our outreach events as well. And the statewide septic code we've been told, will be reintroduced to the Senate, I believe in April. So it should, there should be some more information to come on that. So if there's any questions, I'd be happy to take them.
Yeah.
Mhm.
We'll move on to existing business. Oops. We'll move on to existing business,
We do not have any.
meeting dates.
Oh, yes, we do. The meeting dates, our discussion last month was potentially moving our meeting due to the new subcommittee. As of right now, that subcommittee did get implemented and they will be meeting next month, this same day. But we will just go ahead and leave it as is because they will be out of here, within the hour. And if there's any of a issue or anything like that, we can revisit it. But as of right now, we will just remain the same time and date as we have been.
They'll meet before we do? Or they will meet after we do?
We will meet after they do.
Okay.
Yes.
So you're saying, we're meeting the same date until there is a new one.
No. So last month,
Why is the subcommittee meeting?
so the substance abuse gap subcommittee starts at 3:00. Go ahead, Kim.
Yeah, that's the Bridging the Gap.
Yeah, bridging the gap.
Subcommittee. They'll be meeting at 3:00 on the 3rd Wednesday of the month. They may take up that entire hour. So if you come early, feel free to sit in the audience. It's a public meeting. And then as soon as they're done, you can get started.
Okay, thank you. Any new business to discuss today?
I do not have any.
Okay. We'll move on to our program reports then. We'll start off with personal health.
So the clinics have been steady over the last couple of months. One update that I did want to give is regarding the measles vaccine. and the measles cases that are now in the US. So as of March 13th, there has been 301 confirmed cases in the US. And as of today, we have one confirmed case in the state of Michigan, that is in Oakland County. I did some stats for you regarding, the trends for the MMR vaccine. The stats that I can pull is really only for, children and adolescents. They are, mandated by state law to be entered into MICR if the parent has not withdrawn from MICR, so there's stipulations to that. So this is just for children. But on average, from 2020 to 2025, just for Lenawee County, our babies 19 to 35 months, the immunization rate has decreased to almost 6%. We were at 85, almost 86%, and we've decreased to 80% of children getting vaccinated. It seems little, but when you add all of the different age groups together, it makes a big difference. So for 18 to 35 months, 4 to 6 years, and 13 to 17 years, on average, we've decreased 2.5% in the last 5 years. And with that same data for the state, we've decreased almost 5%. So it adds up to quite a bit of children that are not getting vaccinated. Additionally, the state comes out with immunization report cards for every county throughout the state of Michigan. They just came out with a new updated one for December 2024, and it's for the previous quarter. We were, for 19 to 35 months, we were at 57th place in 2020.
Dear God.
And in 2024, this updated one, we were in 28th place out of 84 counties in the state of Michigan. And for ages 13 to 17, in 2020, we were 63rd place. And currently, with that new report card, we are at 49th percent. And that's with all immunizations together. So there has been a steady decline. Everybody in the state has recognized that. We're doing what we can and having clinics and walk-ins. So anybody that's interested in getting vaccinated, they're welcome to come see us. Other than that, does anybody have any questions for me?
Do you know when you have informational things on recycles, you need people my age to come and talk to folks that don't know anything about measles and mumps and whooping cough, who can just tell you dreadful, dreadful stories.
Are you volunteering?
I volunteer. Yes, I would. I can think of a little neighbor boy, and I really wasn't at home. I was at college at the time, but he had, not measles, the other one, chicken pox. And he's like 7. He's probably 70 today, and he's still 7.
Mm-hmm. Yeah.
One of the programs that we used to have at LISD, which was huge, was a program for blind students. And it was because so many children were born blind. And they were born blind because their mamas got the measles. Men I know have no children because they were sterile because of the mumps. And I remember, I just remember the agony and the fear, the absolute fear. It just breaks my heart to think that there are children not being vaccinated.
All right, we'll move on to environmental health.
Sorry to bother you.
That's okay. Hi, everybody. I don't have a ton this month. You have your report. We are down a little bit on some of our apps and permits. It could just be because there's been a bit of a cold spell, I think. But we'll just kind of keep an eye on it and see. In particular, some of our permits are definitely down from where we were at this point last year. But again, it's just been 1 month, so we'll keep an eye and see how it goes. As it gets warmer, I have no doubt that we'll see things rebound. We did have quite a few people come in yesterday, so I don't have anything major food wise, other than we have sent out the food license applications. As a reminder, the food service licenses expire at the end of April. So every year we send out their applications about this time to get everything renewed. So those have all been sent out. So all the facilities should have plenty of time to get them in and avoid any late fees or anything like that. We've also started just doing some general initial preparation for our vector-borne disease surveillance and our beach monitoring. I have been in contact with our EH tech from last year. He is interested in coming back, which would be great if we can make that happen. So fingers crossed that we'll be able to get him to come back and work with us this summer. He did a wonderful job last year. We're always happy to have people come back who are trained and ready to go right off the bat. And then the only other thing that I had is I took a look at the wastewater monitoring data. I just wanted to let you know that neurovirus is still high according to that. RSV has come down quite a bit and influenza A has dropped significantly, not only in Tecumseh's wastewater, but the other 4 locations that U of M tests. And then also based on the national trend data, the Midwest also just in general has really come down quite significantly, which is good news because influenza A has been very bad this year. So other than that, I don't have anything unless anybody has any questions.
Okay, thank you.
Thank you.
We'll move on to emergency preparedness.
Much like Casey, and good afternoon. Not a whole lot from us as well. One of the things we did do, speaking of the HPAI, is we wanted to reach out to our local dairy farmers and just make the initial conversation that we are available if they have questions regarding, dairy transmission of HPAI and how to protect their employees. So we did send out a letter with information about avian influenza, what the recommended PPE is, and if they have questions or concerns, they're welcome to reach out to us and we can help them with that guidance if they so wish. The APCs in Region 1 completed our integrated preparedness workshop, where we completed our training and planning for a 5-year budget period. And really, other than that, not a whole else going on, working with other community partners in preparation with mass vaccination plan, just on the off chance that we have to do anything with measles, that we have all of our our ducks in a row as best we can. But as of right now, knock on wood, we won't have to do that. Nothing else for me unless you guys have questions.
What basically does one do to prevent the flu from being transferred to the bovine population?
So like being transferred from the bovine to humans?
Well, from the bird to the bovine and then the bovine to the human.
I can't explain, I don't know much about how the bird to the bovine, but I know with the dairy cattle to humans, the biggest really concern is we don't want the one human to be infected with the HPAI, but we really don't want them to have co-occurring infections with the seasonal influenza and the HPAI, because then the data, the DNA can mingle between the 2 viruses, allowing for human to human transmission. So the goal mainly is to protect them from getting infected from HPAI, not necessarily because it's super dangerous, but we don't want them to have co-occurring infections, which then can allow it to become a human to human transfer, if that kind of answers some of your question.
Well, basically, what do you suggest they do to keep them from being infected?
Yeah, so follow the CDC's recommendations for what appropriate PPE to wear, even if you don't have cattle that necessarily are infected or ill. If you do have, contact your veterinarian, work with your appropriate people, and then there's additional PPE that you need to do if you do have sick cattle or sick dairy cattle or anyone that you're working with. But otherwise, you should be wearing like your normal recommended PPE or N95, gloves, mask, face shield, the whole 9 yards. But it really just depends on what you're doing with the cattle. Are you just like tending to them medically? Are you milking them? That kind of thing, what you need to wear.
Okay, thank you.
You're welcome.
All right, we'll move on to finance.
Well, hello. Very, very brief this month. So our second quarter ends at the end of the month and we're gonna start gearing up for this next budget season, which I feel like the last one just ended, but it's already starting to circle back. So that's really all I have for this month. Are there any questions? All right, thank you.
All right, we'll move on to public comment. Do you have anything for us, Kim?
I do not today. Do you have any questions of me?
I do not.
Okay.
We started planning for the drug take back day. So it's gonna be April 26th, Saturday, 10 to 2. So
Okay.
start promoting that.
I'm sorry, you said 10 to 2?
Yes. I will be there, so come say hi.
All right, any other public comment? All right, I'll be looking for a motion for adjournment then.
So moved.
Support.
What
All those
time
in
is it?
favor?
Aye.
All right, we stand adjourned.